Assalamualaikum and hi everyone. My name is Amylia binti Afrizon and my metric number is 254144. My supervisor name is Dr. Muhammad Shukri Abdul Hamid. Today, I will present the final year of my project entitled Evaluations of Sleep Pattern and Academic Performance among UUM students. This is an outline where I will explain about the introduction, literature review, methodology, data analysis and result, and the last is the conclusion. First, I will explain what is a sleep and CGPA. Sleep is a state of the body and mind is that of the rest at the night after being tired of doing daily activity. Everyone, especially adults and students, need to get at least 7 to 9 hours of sleep per day. University students with sleep problem can have a poor economic performance, poor health, and poor mood. Students with a sleep problem will cause fatigue in their body system and result in excessive daytime sleepiness, that called EDS. Meanwhile, cumulative grade point average (CGPA) is a common metric used to assess the academic success of university students. The study was conducted to determine the relationship between the student's sleep pattern and academic performance among UUM students. Students will have difficulty waking up in the morning when they have difficulty sleeping at night. Furthermore, their focus in the classroom will be lost and they will not be able to focus fully on the learning taught by the lecturer. This will make it difficult or lazy for students to attend a morning class or not be able to attend class. Sleep is especially important for a student because neurons in the brain may not be able to work up properly and become physically active and can result in a physical injury if a person does not get enough sleep. Lack of the sleep can also lead to heart attack, obesity, diabetes, and curtain cancer. The three research questions there is how a student generally affect the sleep time. Second, how is a college or university related to the sleep time, and how is problem in the sleep can give an effect to academic performance. There is a three objective in this study. The first is determine student demographic characteristic and sleep time. Second, determine the relationship between the college and sleep quality. And the last, determine the relationship between the PSQR and academic performance, that is CGPA. Scope of the study is involve University of Utara Malaysia students from semester 1 to semester 7 and above. The 200 questionnaire was created using the Google form and will be distributed through the WhatsApp and Telegram using the PSQI as a method for measuring aspect of the sleep. I will explain about the literature review. First is about the sleep and health. According to the drama and mechanic, sleep deprivation has classified into the three categories: for sleep deprivations, partial sleep deprivations, and sleep disturbance. Sleep deprivation was assessed based on the total long-term sleep deprivations where working was more than 44 hours. Secondly, short-term sleep deprivation which will work up to 45 hours, and the partial sleep deprivations. Delayed sleep Past syndrome DSPS is a long wake sleep time. Normally we can usually sleeping late and working out too late on the weekend, and sleep problems. Students with sleep deprivations perform poor on cognitive ability and academic performance. Studies show that the lack of the sleep and lead to the mental and stress problem and the functions. Based on quality of the sleep, lack of the sleep and drowsiness and correlated with the worst performance, especially for a student. Poor sleep will cause inadequate behavioral and mood swings during the day. Studies show that there is no academic success of the student with the sleep problem. That's the neurology of the sleep. The sleep process is to control the mechanisms of the actions of the control the autonomy of the functions, cognitive, behavioral arousals, and motor functions. Also, the level of the which awareness is gained during the day is NREM sleep. NREM consists of two stages as contained in this slide. There is a two factors that affect the quality of the sleep. There is a physiological consequences of the lack of the sleep and the sleep deprivation effect. The sleep pattern by demographics show that there is a difference in the sleep quality of the sleep between the man and the woman. Women are said to have a worse sleep than the men. In addition, women experience a high rate of slow wave sleep than men. This is the sample size that include the female and men in University of Malaysia student. There is 200 students who answer this questionnaire. The respondent is a teenager, their age from 19 to 26 years old, and there is a 3 college at UUM that include the CHAS, COB, and Qualkis. Okay, next, the methodology that I use in this study is a descriptive questionnaire. There is a 4 sections in this survey and included the demographic informations. Then by using the PSQ, I used to distinguish between poor quality sleep for an individual. The PSQR consists of 7 components, consists of 7 part mentioned in this slide. The score of each component can vary from 1 to 4. The scale of 1 to 4 is shown on this slide. Then by using chi-square to determine the correlations between the demographic and sleep time, also used to determine the college and quality sleep relationship. Then two-way ANOVA is also used in the define to the relationship between the age, sleep time, and CGPA. So we can see this is the demography. Through the chart above, it is found that the number of the female respondents who answer this questionnaire is highest than the male respondent, which is 173 people, equivalent to 86%. Through the pie chart above, it is found that the respondent aged 22 until 25 years old, more people who answer this questionnaire, which is amount to 181 people, equivalent to 90.5%. There is 3 schools in the UUM. From the picture, we can see this Chess College are the highest, then the other, which is 114 people, equivalent to 57%. YCOB is the second highest, where the number of the respondents is 62 people, equivalent to 31%. Then Malay race who answered the questionnaire were 151 people at the same 75%. Respondents from semester 7 and above show a greater number compared to other semester, which is 68%, equivalent to 137 respondents. The respondent who got a CGPA between 3.34 to 3.66 show the largest number compared to the other, which is 41%, equivalent to 82 respondents who answered this questionnaire. 3-pointer to 3.33 also showed the second highest number of the respondent, which is 65 out of 200 respondents, equivalent to 33%. The respondent sleep late at 12 midnight and above. There is 144 out of 200 people, equivalent to 72%. Respondents who have less than 6 hours of sleep show the highest number of 133 people, equivalent to 60%. This is to determine the student demographic and sleep time. From the table, we can see the chi-square value is 0.65 and p-value is 0.88. So there is no significant value. The hypothesis will be rejected. We can conclude that the gender of respondent does not affect the sleep quality. Second table to determine the relationship between college and sleep quality. The chi-square value is 3.561 and the p-value is 0.177. There is no significant value. The hypothesis will be rejected. We can conclude that the college does not affect the sleep quality. Next, to determine the relationship between CGPA, age, and the sleep time, the p-value for the interactions between that is 0.024, which is less than the 0.05. The value of SF is 1.18. We can conclude that the main effect of the factor is significant. The difference between the sum of the factor level means are significant. The age and the sleep time will give the effect to CGPA. This is the comparisons between the PSQR and CGPA. Students with a CGPA of 3 to 3.66 have a poor sleep quality, whereas students have a less This is hour of sleep, which is 68%. The student did not find enough sleep. They feel the quality of their sleep was good, where the percentage was the highest, 64%. Student experienced sleep dispersal at least 3 times a week, 53%. Many students do not take the use of a pill, which is 80%. Students work out several times at the night, which is less 2 times a week, 40%. And students who often work out at the night more than 5 times show the CGPA percentage 30%. Overall, we can see that the student with the less stress will not affect the CGPA. The last is a conclusion. Overall, through this study, it was found that the student who is sleep deprivation will not affect their CGPA. When the student lack of sleep time of less than 6 hours, by the CGPA they get is between 3 to 3.66. This indicates no significance between student sleep time and CGPA result. In addition, the results that can be seen are the type of the gender will not affect a sleep time. The main limitations in the study is to obtain the male respondent. The male respondent who answers these questionnaires was less than half of the 200 respondents who answered. This makes it quite difficult to research to see the comparisons between the man and the woman, which will have a greatest impact on the sleep problem and academic performance. That's all from me. Thank you.